Courtney Doherty is a registered clinical counselor here in BC and has been working with the Parkinson Society BC for 8 years. She provides counseling and consultation services to those affected by Parkinson's, facilitates 2 support groups, and helps with our education and support services. And her father has Parkinson's disease, and that is what led her to this area of counseling. Courtney, welcome, and thank you so much. I will pass it over to you now.
Thank you. Hi, everybody. Thanks, Alana, so much for the introduction. I'm Courtney, as she mentioned, and I look forward to our presentation today. So today we will be discussing mental health and Parkinson's disease. And so I will be going over, here's the outline for today. So a little bit of an overview of what Parkinson's disease is in general. What are mental health challenges? What are some causes of mental health challenges in Parkinson's? Some barriers to diagnosis and treatment of those mental health disorders. And then we'll talk about treatment options and some practical tips to help with such mental health challenges, and then just some key points at the end. So I'm happy to answer questions at the end. So if you have any, please don't hesitate to ask. Hopefully there's a lot of room left up at the end. Okay, so what is Parkinson's disease? Well, it is a progressive neurological disorder, also known as a neurodegenerative disorder. In Canada, there's approximately 100,000 people with Parkinson's, but that's actually a quite an old statistic from 2008, so it's likely quite a bit higher at this point. In BC alone, there are over 13,000 people living with Parkinson's, and the average age of diagnosis is usually around 60 years of age. However, up to about 20% of individuals develop Parkinson's symptoms before the age of 50. And we refer to anybody under the age of 60 when they're diagnosed with Parkinson's as having young onset Parkinson's disease. And it is actually, unfortunately, more and more common. You know, I have clients in their 40s and their 50s. I even had a client in their 20s at one point. So, you know, what once was just thought of as an elderly disease is actually, it's actually proving not to be such the case. The more we learn about it and the more we know how to diagnose. So in 2018, it was estimated that 12% of Canada's population over 80 lives with Parkinson's disease. So it's quite common. It's the second most common neurodegenerative disorder after Alzheimer's. So Parkinson's does not discriminate with respect to race, gender, region of the world. We do see it slightly more prevalent in men than women, but not a significant amount. And so generally, what is it? Well, people develop Parkinson's symptoms when they have a loss of dopamine in a certain part of the brain. It's in the mid sort of back brain called the substantia nigra. And that is an area that is important for controlling movement. So when we develop Parkinson's, for some reason, these neurotransmitters in that part of the brain that produce dopamine are dying off. So it's only when at least about 50% of those dopamine producing cells are lost that we start to see symptoms of Parkinson's appear. So that's why so many of, I'm sure many of you listening today and many of my clients say, you know, by the time they were diagnosed, thinking back, oh yes, I could see I had it for 5, 10, maybe even more years. They could see subtle signs that, okay, maybe that was that, but we wouldn't know. And so because these cells of dopamine are slowly dying over time, it's really hard to catch it before, the symptoms start, because you don't see those symptoms until so much of the dopamine is already lost. Okay. So what are some of these symptoms that I'm talking about in Parkinson's. We often classify them in sort of two different categories. So what people most commonly think of as symptoms of Parkinson's disease fall typically under motor symptoms, or what we think of as more physical symptoms. So the most common ones are resting tremor, rigidity, slowness of movement, also known as bradykinesia, balance and postural impairment, and sometimes a softened voice called hypophonia. So these are only some common motor symptoms, but usually the cardinal are those top four I mentioned. Now, what many people don't recognize or don't realize is that aside from the motor symptoms, there are a whole slew of what we refer to as non-motor symptoms. So they are sort of invisible symptoms, so to speak, not so physically apparent. So things like hypomimia, which is reduced facial expression. Some people refer to it as a Parkinson's mask. So, despite maybe finding something funny or happy, our faces may be not as expressive in Parkinson's. Sleep disturbances, unfortunately, constipation or urinary problems, fatigue across the board. I find that one to be pretty common among all clients. Low blood pressure, especially when changing postures, which is known as hypostatic orthotension. So if you're going from a sitting to standing position, the signals don't get from our brain to our autonomic system, which is what controls our blood pressure, as quickly. So sometimes we can feel that dizziness, and it can sometimes lead to falls, things like that. Even people without Parkinson's can sometimes experience something like that. We've all had that feeling of standing up too quickly and getting lightheaded. So it's just that slowed effect in Parkinson's. So low blood pressure, some visual issues, swallowing and communication issues can sometimes occur. And the biggest one, and the one we're going to focus on today, is changes in mood. So changes in mood is a big one. So here I've decided to include this slide, which is cognitive versus mental health. Now, mental health can include cognitive health, but for the purposes of this conversation and this presentation today, we won't be discussing cognitive health and impairment as it pertains to Parkinson's disease. I will just quickly say, so cognitive impairments in Parkinson's may include problems with executive functioning, maybe word finding difficulties, difficulty with attention, maybe memory recall problems, planning, reasoning and problem solving difficulties. These are some common cognitive impairments, but we do have presentations on that, and that's a whole other discussion that we have available, but we will be focusing more on mental health issues, which I'll get into explaining a little bit more soon. So at least 50% of people with Parkinson's experience depression and or anxiety. Now, that is an older statistic, and I would not be surprised if that was a higher percentage. So what is depression? I think it's often used as a very simplified term these days. Oh, I'm so depressed. I haven't seen my friends in so long, or oh, I feel so depressed, or but it is a real medical condition, and it has many different elements and symptoms, from emotional to physical to behavioral to cognitive, that are present when we're experiencing true depression. And so what some of those may look like, as you can see on my slide, some emotional symptoms may include feelings of constant sadness, feeling worthless or hopeless, loss of interest in and pleasure. Here we go. Loss of interest or pleasure in certain things that we used to enjoy. Physical symptoms of depression may look like low energy. Maybe we have aches and pains. Could look like insomnia, which is the inability to sleep, or the flip side, hypersomnia, where we're always wanting to sleep. Maybe some changes in weight. Some behavioral symptoms of depression may include changes in appetite. So maybe we're overeating or we're undereating, and maybe an impression of restlessness. And then some cognitive symptoms with depression may include difficulty making decisions, focusing or concentrating on certain things. And when it is more severe, we may have suicidal thoughts or what we refer to as suicidal ideation. So we may have thoughts that, it would be better off if we weren't around. And those are obviously very serious thoughts to take into account and to try and get better from. So the interesting thing, if we look at this list and we take, if we cover up the word depression at the top of my slide, a lot of these symptoms overlap Parkinson's symptoms. So, it's hard to sometimes tease apart. Is it depression? Is it the Parkinson's? Is it a combination of the two? So this is what the goal of my talk today is, to really just educate on what mental health issues can look like in Parkinson's and teasing some of them apart from the actual Parkinson's diagnosis. And then we really need to educate ourselves and become very self-aware on what is going on for ourselves and be truthful. Okay, the next one I'm going to talk about is anxiety. So like depression, anxiety is a real medical condition, and it affects people on an emotional, physical, behavioral, and cognitive level. And so some emotional symptoms that anxiety involves is, feelings of fear and or maybe nervousness, having excessive worry. Some physical symptoms are things like increased heart rate and blood pressure, maybe some shallow, heavy breathing, feelings of dizziness or lightheadedness. Some behavioral symptoms may be, a sudden feeling or urge to escape or avoid certain situations or certain activities or certain people. And then some cognitive symptoms may be things like difficulty with ruminating thoughts, which are thoughts that go around and around. That's rumination. And realistic thinking. So we may have difficulty thinking realistically, and so we have a lot of irrational thoughts, and it's hard for us to sort of get ourselves out of that bubble and think in a more rational way. We can get caught up in this loop. And so again, and like depression, these are just some of the symptoms that people may experience, but it is unique to each individual. So you do not need to have all of these symptoms to be diagnosed with anxiety. And it's interesting that if you experienced anxiety pre-Parkinson's diagnosis and maybe even years and years ago, you may be more susceptible to feeling the effects of anxiety post-Parkinson's diagnosis. Okay. So another thing I really want to speak on is apathy. Now, it's not classified as its own mental health disorder in what we call the Diagnostic and Statistical Manual of Mental Disorders. So it's not classified as its own, but it is very common for people with Parkinson's disease. About 40% of people with Parkinson's experience some type of apathy. And it can be hard to distinguish between depression and apathy. So what is apathy? It is often characterized as amotivation. So a lack of interest and motivation in certain things that we may have had interest and felt motivated to do previously, but it's often without sadness and hopelessness and those possible suicidal thoughts that depression may entail. So apathy is a part of depression, but we can also have apathy without depression. So we just have mostly that lack of motivation and drive, but we don't feel those constant thoughts of sadness. We don't, have all complete lack of interest and pleasure in doing things. It's separate as well. So, it is very important to try to understand what's going on for us so that we can distinguish between the different feelings of depression, anxiety, apathy, all of these different things, so we can get the appropriate treatment. Okay. So the next slide would be causes. So what causes mental health issues in Parkinson's? Well, I often say it's not just, a cause and effect. So many people think, well, yeah, no wonder I'm experiencing some sadness or some anxiety. I've just been diagnosed with something like Parkinson's. And yes, it may be a reaction to your initial diagnosis. It also could be reaction or feelings you get with the changes you experience as the disease progresses. However, what I want to make clear is that it's actually the changes in the brain chemistry that causes Parkinson's that can also be causing these mental health problems. So that lack of dopamine, that miscommunication in the brain that causes Parkinson's disease may also be causing symptoms of depression, anxiety, and or apathy. Okay. So a big thing here to note is that it's not, oh, I need to just suck it up and get better, or I need to get over it, or I need to, it's about willpower. No, this is they're true, real medical conditions, and there are real chemical reasons why this is happening. Okay. So apathy is a little less understood for the causes, but it is also believed to be based on biological factors and also changes in the brain. So it's also important to note that it is normal to be worried about your symptoms and to wonder, what is going to happen in the future. So some anxiety is normal and feelings of worry, but it's when it becomes persistent and when it is happening, you're feeling worried and anxious more often than not, and maybe it's affecting other areas of your life. That is where we need to really think, okay, maybe there's something else going on here, and we need to seek some help. Okay. So the next slide I have is factors as barriers. So there are some factors that that act as barriers to diagnosis and or treatment. And one of them may be the stigma that still unfortunately does surround mental health. So we have made, I think, a lot of strides in the recent past in terms of recognition of mental health and more discussion of it and more acceptance of it, but it unfortunately does still exist. So some people may feel embarrassed about what they're experiencing. Like I said earlier, they feel like they might just need to get on with it, or if they ever felt some of these symptoms in the past, they were able to just kind of, pull up their socks and move on. And then others may even completely deny feeling depressed or anxious when maybe their loved one mentions it to them because they don't want to admit it to themselves. And so that's where I said a few slides ago that we need to really educate ourselves and become self-aware and honest with ourselves, because we're really just doing ourselves a disservice in the end. It's important that we recognize what's going on and recognize that it's not a character flaw, and that, the sooner we recognize it, the more we can help ourselves and move forward, not feel so stuck. So the next factor that acts as a barrier is the lack of awareness that mood disorders are a part of Parkinson's. So like I said before, so many of these symptoms overlap with what actual Parkinson's symptoms look like. So maybe, the feeling you're tired, having pain, maybe a lack of appetite, or changes in weight, all of those things could be just Parkinson's. And so it may go unnoticed and untreated by not only yourself, but by your healthcare practitioner. And then finally, well, I also said this already, so it's very important that we start to notice the differences between the physical symptoms of Parkinson's and any mental health challenges we may be having. Maybe we start to jot certain things down. Maybe we do ask our loved one. Maybe we do, really listen when our loved one or doctor says, you seem like you're struggling a little more than before. Is that happening for you? So just really trying to recognize what's going on for us and being honest and asking, when you go to your next appointment, maybe ask about that. If you have no idea whether it is something you're experiencing or not, if you can't decide if am I just sad sometimes or is it always, and is it a problem? And just opening up the conversation and asking. And so the next slide we're going to talk about, and we're going to focus on a lot here, is treatment. So that's the good news, is that there are treatments, and there are a variety of options that are available. So you don't have to just live like this and feel like, okay, well, this is a part of Parkinson's and there's not much I can do about it. So there are certain types of medications that can help with symptoms of depression and anxiety. They are different than the Parkinson's medications you may be on currently. And it's worth asking your physician and or neurologist if you feel like this is something that you maybe should look into. If you're really scared and you don't believe in medication, but you're not feeling good, and so maybe you want to just try a small dose, just inquiring. And it's important to note that medication for anxiety and depression can take some time to work. So sometimes doctors say 2 weeks, sometimes it can take up to a month, I know in my experience with clients. And you want to find the right one, and one that doesn't interact negatively with any of your other medications. So having a little bit of patience and inquiring about that. Likewise, if you are already on, which some of you may already be on some of this medication, and if you're not feeling the benefits from it, thinking about, okay, you should be taking the medication at the same time every day. We should be taking a dose that's appropriate for us. So if we're not getting the therapeutic effects from the medication, maybe we're on too little of a dose. And if we're taking it anyway, we might as well get a dose that's going to actually be therapeutic for us. So help us with our symptoms. So inquiring about that. And then I have utilizing the UBC pharmacist's clinic. So if some of you are unfamiliar with this, there is a wonderful clinic at UBC that offers free pharmaceutical consultations. It's a self-referred process, so you can just hop on the phone and make an appointment, and they will go over, it's about an hour-long consultation where they'll go over your symptoms and what medications you're taking. And if they believe that you maybe need a change of medication, or you think you do, or an addition, they do not prescribe or change anything on the spot, but what they would do is send a report over to your healthcare practitioners, who would then be able to take that into account and make those changes. So it's a really great resource to utilize. Okay, moving on from medication. So another one is familial and social support. So this is so important. So when we're dealing with mental health issues, we tend to want to isolate, and that's usually the worst thing for us. We want to just sort of revert in. We become like lack of energy, lack of pleasure, lack of desire, yet that just makes everything shrink even more, and our world become just totally engulfed by these issues. So it's important to sort of push ourselves to reach out still, even though that's not what we want. And especially important, I would say, in today's age where we have been so isolated for, a year now, if not a little bit longer. So important to connect with friends safely, maybe over the phone, maybe if you can do it safely, going for a walk with a close by friend outside at a distance, just trying to connect somehow, okay? And then if all else fails, it would be really great if you join something like a support group. We have tons of support groups. Pre-COVID, we had about 50 support groups throughout the province. And currently we have, I believe, at least 30 that are meeting online. So if you don't know how to sign up for that, we can send you the information, but it is something that is really, really valuable and allows you to connect. And there's a whole slew of different ones. If you're newly diagnosed, if you have young onset, if you have a more, advanced stage of Parkinson's, if you're a caregiver, we have a lot of them. So it's something to keep in mind. And then we also have this program called PD Link, which is phenomenal, which is a program that connects individuals almost like a peer support. It's a peer support program. So, let's say we try to match certain individuals with others that are like-minded, and that's something you can reach out to us as well. So if you don't feel like you have a lot of your own support, you can always reach out to something like that to gain other support. Okay. Psychotherapy and mindfulness. I'm going to be speaking on this at a bit more length after this slide, because obviously that's something I work in and I specialize in. But so, seeking individual counseling or couples counseling or family counseling, and some of the most effective counseling strategies are referred to as CBT, cognitive behavior therapy, which again, I'm going to get into in detail after this slide, and something like exposure therapies. So, if we are anxious about going outside, we would want to avoid going outside, but that would just make the anxiety grow. So we need to expose ourselves to the thing we're anxious about, but it would be slowly, and it would be, with a professional, depending on the severity of the anxiety, as an example. And then mindfulness, so staying present, and I'll be speaking more on this in detail after this slide. So finally, let's not forget about all those complementary and alternative therapies. So exercise obviously is, you've probably all heard it. I'm going to say it again, but it is probably the number one best thing for Parkinson's, but also probably one of the number one things for the treatment of mental health issues. So medication is supposedly not as effective as regular exercise for depression and anxiety. So I know it's hard if we're not into a regime to exercise, but doing whatever you can do. And again, I'll talk about this a little bit more later. Looking at our diet, so making sure we're getting appropriate supplements. If we don't have a really good whole food diet that's incorporating many things, we still know that the Mediterranean style diet is one of the best for Parkinson's. Art therapy, things like meditation and visualization. Acupuncture can be super helpful in reducing pain and calming individuals down. Registered massage therapy, music therapy, and things like reflexology and chiropractic treatment. So all of these are just absolutely incredible complementary therapies if you're able to seek any of them, and or at least target things for yourself, like doing art for yourself, or focusing on your diet, or getting out and exercising a little bit. And I'm not sure if you're aware, but I would like to make you aware that since COVID, we have uploaded so many exercise videos online that you can access from the comfort of your home. My colleague, who is wonderful, is Shelley. She's a neurophysiotherapist, and she has led so many of these, a variety of exercises. So it's available to you all. And it's, if you didn't make the actual event that happened, it's all recorded and available on our website. So there we go. So the next one I want to dig into now is psychotherapy. So I mentioned earlier the term cognitive behavior therapy, also known as CBT for short. And this is one of the most empirically valid therapies to treat mental health disorders. And it's really based on the premise that, and I noticed I don't have enough commas here in my second bullet point, but we are all in a certain situation, and then that situation leads to us having certain thoughts and then certain emotions and certain behaviors based on that situation, and they're all interconnected. So to help you with that, I have a visual here. So a situation occurs, we have certain thoughts based on that situation that lead to certain emotions or feelings about the thought we just had, and then certain behaviors. Okay, bear with me. I'm planting a seed today if you haven't heard about this. So I will give a more detailed example. So let's say the situation is you see a friend walking down the street, so you wave at them, but they don't wave back. Some people may think certain ways, but I'm going to give this example just for example's sake. So an initial thought you might have based on that situation might be, oh gosh, they don't like me. I must have done something wrong. Oh, why are they ignoring me? You know, this sort of negative spiral. So if you have those kinds of thoughts, how might we feel? What kind of emotions might we have? We probably wouldn't feel super happy and, you know, neutral based on those thoughts, those kinds of thoughts. We would probably feel a variety of emotions. Some people might feel sad, you might feel confused, depressed, anxious, vulnerable, maybe self-conscious. I could go on. And so then how might we act or behave based on those thoughts and emotions? Well, it depends on the person. But for example, some people may be so upset that they go home and they cry and they stay in bed. Others may react by ignoring that friend the next time they see them. Others may just replay the scenario over and over in their head repeatedly and think, oh gosh, when was the last time I saw them? Did I say something bad? Did I, you know, that kind of thing. And it's just a vicious cycle. So then if we behave that way, then it just reinforces those negative thoughts we had, the emotions, the behaviors. So it's, again, if I go back to this slide, it's all interconnected and it's a vicious cycle. So on the flip side, I just want to give an alternative example to this same exact situation. So the situation is the same. Walking down the street, you see a friend, you wave at them, they don't wave back at you. An alternative thought, or what you might think on maybe a different day, would be, oh, they mustn't have seen me. Maybe they're preoccupied. Maybe, you know, I wonder what's happening for them today. And then what might be the emotions based on that kind of thought would probably be neutral or maybe a bit confused, but probably not upset or sad or self-defeated like in the previous example. And then what might be some behaviors or ways we react in that scenario? You know, it could be a variety of things, but for an example, we may go call the friend later just to see how they're doing and check in and be like, hey, I saw you earlier and I waved. Did you see me? And yeah. And this kind of way of thinking and this pattern would probably be, you know, just float right off of your shoulders within a matter of minutes. It wouldn't, like in the previous example, be something we repeated in our head over and over and over again. Okay. So that is the premise of CBT, cognitive behavior therapy, that our thoughts, our emotions, and our behaviors are all interconnected, okay? So the way the therapeutic part of cognitive behavior therapy works is we first want to start to identify our negative thinking styles and maybe any negative core beliefs that we have. So what I mean by that is if we are constantly, you know, if we are faced in a situation like I gave the first example, and we immediately go to self-doubt and we immediately think, what did I do? And we, you know, maybe we have a core belief that we are not worthy, or we are unlovable, or something like that. And I know it sounds so cliche, but we all have core beliefs that we have developed from a young age. And some of us may only have one or two, and they may not really affect our lives negatively, but and some of us have many more. And so we develop some of these at a really young age because that's the pivotal, the real learning phases of life in those first sort of 7 years of life. It's big development. And then as we go through life, whenever we go through an experience that sort of that reinforces that negative core belief, we adopt it really easily as proof that, see, I am unworthy. And for example, if we go through experiences that disprove it, that, you know, well, actually I have a lot of friends and I have a wonderful family and I'm, you know, I'm really smart and I got in a great school, and, you know, we often tend to disprove that, and we just don't, we look past that story and we minimize those feelings. So that is something that is what I mean by a negative core belief that we might have. And so really learning about ourselves, and that's where psychotherapy can come and help, because you can work with someone like myself or another counselor to identify these kinds of things, to try and break these kinds of patterns and these kind of thinking styles. So another really good example of a common thinking pattern that is not helpful, so we call it a distorted thinking style or an unhelpful thinking style, is something like catastrophizing. So, you know, it's going to be the end of the world if this happens. And believe it or not, many of us do that. You know, it sounds funny when I'm giving an example right now, but many of us do that, you know. So, oh my gosh, I've been diagnosed with Parkinson's and it's going to be like this in a year. You know what I mean? So we go to worst case scenario. Another example might be all or nothing type of thinking. So I need to do it perfect or I'm not going to do it at all. Okay. And then another one, there's several, but I'm just giving examples of overgeneralizing. So, oh, they didn't say hi to me, so they hate me now and they're not going to be my friend anymore. So, you know, it's really common for us to have some of these ways of thinking, but it's important to learn those patterns, because over time we can sort of identify that we're doing it and we can actively work to reframe our thoughts. So for example, if I go back to this first example with the situation, if we have learned about our patterns and we recognize we're having a bad day, you know, we may have that initial thought of, oh, they don't like me, maybe I've done something wrong. But then the way that cognitive behavior therapy works is for us to be like, oh, wait, I'm doing that again. I don't know that they don't like me. Actually, they just called me last night. And so you sort of, with many different tools, we learn to reframe that thought, which then would lead to better emotions and better behaviors. Okay. Hopefully this makes sense. It's a little bit hard and tricky to do it in a presentation style. Okay, so the next part of this is we could focus. So that's coming from a cognitive place. So targeting those thoughts and those beliefs and targeting it that way. We can also come from a behavioral side. So targeting certain behaviors, which then might lead to better thoughts and emotions. So we need to identify negative behaviors that we're engaging in that we know are unhealthy. And it can be hard to do, but first step is just identifying them. Okay. And again, there's a typo there, dear. And then we want to create new and healthier behaviors that we can go to. And it's a process and it's a practice, but that's where we would start. And we want to especially be mindful of apathy and amotivation. So because again, with Parkinson's, it's so common. And so if we say, well, yeah, but I have no energy to exercise, but yeah, but I can't do that, you know, well, this is something I work on with a lot of my clients, and it's committing to 5 minutes of something, because we can do anything for 5 minutes. Anybody can. Even if you're severely depressed, you can commit to at least getting out of your bed, brushing your teeth, and then you can always go right back to bed. But the idea there is that when we commit to something just for 5 minutes, knowing that we can go back to doing whatever we were doing before if we want, we usually don't, because it's getting there, then it's getting up and going. That's more than half the battle. So that's what I mean. If you see under committing for 5 minutes, I say action before motivation. So people actually think it's the other way around. People often think We sit around, we feel motivated, and then we get up and go to the gym kind of thing. So motivation before action. But no, it's the other way around. So action coming before motivation. So if we just make it a non-negotiable and we say, okay, I'm at least getting as an example with exercise, if we say, okay, I'm at least just going to get my running shoes on, I'm going to walk out the front door, I'm going to walk 4 or 5 houses, commit to 5 minutes, okay, whatever that might look like for your situation. And I can always come right back inside and go to bed or sit on the couch or get comfortable again or whatever it might be. Because usually once you're out there, 5 minutes turns into 10, and at least you've changed your scenario and it's starting small. So again, that refers back to my black and white thinking. You don't have to do an hour to make it worthwhile. 5-10 minutes is a great place to start. So, looking at those shades of gray instead of the all or nothing, I got to do it all, or I'm just going to sit here on the couch kind of thing. So making it a non-negotiable, starting with 5 minutes and trying to take away any barriers that might stop you. So if you don't have running shoes, or if you can't get them on by yourself, or if you can't go at that time of day because your meds haven't kicked in yet. So working around that. So making sure you have, shoes that fit you. You either can put them on or you have somebody that can help you put them on. You go at a time when your medication is working optimally for you. So removing any barriers that will prevent you from at least getting up and going and doing. Okay. And then finally, this is super important when we have goals. So again, I'm going to stick with this exercise goal, but connecting to the why of our goal when the going gets tough, because it always does. We set a goal and we may go strong at the beginning, and then we're like, okay, I need to do this. I need to do this. But why are we doing it? And we need to make that why a strong one. Like we're doing it for ourselves and for our grandkids and for, to be able to feel stronger and walk up the stairs and improve our balance. And, it needs to be a strong one. And I even recommend that people write it down and have it in a few places, maybe have it on the front of the fridge so that, a week or 2 in when it's like, oh, I don't want to it's raining. I don't want to go for a walk. But it's like, no, you know what? This is why I'm doing it. That is going to take you a lot further than if it's just like, oh, I need to go on a walk. Oh, I know it's healthy for me. I should be doing this. Shoulds is not something that in my world we like. We say don't should on yourself. So just to keep that in mind, the why of your goals. Okay. So that is CBT in a nutshell. And it's something that you can either work on yourself, because it can be very self-directed if you have the right, workbooks and books on it. And I'm obviously biased, but I tend to think it's probably easier to work with a professional like myself to learn some of these tools and these skills. So now we're going to talk about mindfulness. So mindfulness is really, many of you have heard this term. It's really, instead of being mindless, we are being mindful. So we are practicing staying present in this moment without any judgment. And what I mean by that without any judgment is that we're usually, if we're in a certain given moment, we're thinking, oh, well, I don't like the way that light looks, or I don't like this, or we're putting judgment on something, or I don't like the way I'm feeling right now. We're just being here, super neutral. It's a very different way of being if you're not familiar with it yet. But it's also quite simplified when we can learn it. And so mindfulness and the practice of mindfulness is really all about learning about your mind and how your thoughts come and go, and doing it without a reaction. So we all have, thousands and thousands. I don't know how many thousands, but I think I once heard it was like over 30,000 thoughts in a given day. I feel like it's more than that. And so we need to learn our patterns. We need to learn like, okay, when am I following this train of thought that's leading me nowhere good? And how do we get off that train of thought? And okay, how to, and staying present, right? We often have thoughts that tend toward the past. So we're often angry about things that happen in the past or anxious about things that are going to happen in the future. And we are rarely living right here, right now, which we know we have. We can't go back and change the past. It's a fact. We know it. I always say my magic wand's broken. I can't do it. It's in the workshop. But we know we cannot go back and change the past. So it's easier said than done, but just recognizing those emotions and recognizing we can't change what happened then, okay? As much as it may not be great, it just is what it is. And likewise, we cannot predict the future as much as we think we can, or as much as we think we have a false sense of knowing what's going to happen tomorrow. None of us do. None of us know that. And so, of course, we need to, when I say this, like, you're not going to go blow all your money today. And, we have to have some future forward planning, but it's again, using today and the present to be as effective in helping us for tomorrow. So if we always are living in the past and the future, we're robbing ourselves of right now. And it's easier said than done. I completely know that, but it's a practice. So it's about just noticing again, noticing how your thoughts work. Oh, I'm back there again, not helpful. Bring it back to the present. So a really nice way of doing that, I like to use this with clients, is especially with future thinking and anxiety type of thinking. Those thoughts often start with a what if. So what if I'm not healthy? What if my spouse can't do this? What if I this? What if? Okay. And again, we're not sure. So we could spend all, however long we want wondering those what ifs and be no further ahead. And then we're robbing ourselves of what is happening right now. So replacing those what if thoughts with what is happening right now. Well, today I am healthy enough to go for a walk. Today I am able to do X, Y, and Z. Today I am going to choose to do blah, 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 blah. So replacing what if with what is today is a good kind of quick tip to use to keep thoughts more present. And then I skipped this one, but I want to go back to the 5 senses exercise. This is a great one that keeps you or brings you to the present moment when you're not feeling very settled. So if you start to notice you're feeling a bit anxious and you're not feeling settled, as I say, this is what we call a grounded exercise. And it's a mindfulness exercise. And it sort of brings you back to the ground and to the present moment. So what it is using your 5 senses to literally name things you see right in front of you. So many people say, name 5 things you see, 4 things you hear, 3 things you taste, 2 things you touch, 1 thing you smell, kind of thing. And I just gave an example. You can do it in any order. And that's great. If you want to go through all 5 senses, wonderful. I think even simpler, if that seems like too much, I often just tell people to name 5 things they see right in front of them. And I mean literally, like lamp, computer, water bottle, headphones, agenda. I'm naming exactly what I see right in front of me. What it does is when we're feeling anxious and that's our nervous system kicking in, okay? And that can be a whole other talk, but we're getting anxious. Our fight or flight response is starting to get activated, okay? So when we feel those symptoms, our rational, logical part of our brain shuts down. So we can't really think that clearly. We're in this state of worry and stress and kind of hypervigilance. So a way to counteract that it's a simple task, so to name those 5 things right in front of you, because what it does is it's simple enough to do when you're feeling activated and your nervous system is elevated. And what it does is it turns that rational sort of part of the brain, which is the prefrontal cortex, the front part of the brain, it turns it back on. So it sort of lowers the alarm of the anxiety and turns back on that rational feeling and the like, okay, no, I'm okay. I'm right here. I'm sitting in my home. Everything is fine. Everything is safe. Everything is okay. So that's the 5 senses exercise in a nutshell. So Other ways to practice mindfulness is through guided recordings or certain apps. Some really good and common ones out there are Headspace and Calm. I would recommend both of those so much so. They both have free versions, so I would probably not bother paying for anything. So just making sure that you select the free trial or whatever, and you can keep using that, especially with Headspace. I know that's the case, and it really teaches the elements of, noticing that thought, and then this moment you notice the thought's gone, just softly, gently bringing it back to the present moment. And then your thoughts will be gone again. And then you gently bring it back to, so the goal is, again, to learn your thought process and how often we're getting on that train, and then to gently bring it back to your breath and, feeling your bum in your chair and your feet on the floor, and just repeatedly doing that. So the more and more you practice that, the longer you're able to stay right here, right now. I'll actually be leading a Mindful Moments series starting in April, and I will be walking you through a guided relaxation mindfulness series. So that's something that if any of you are interested in signing up for. And then also, not only practicing in this sort of sit down, listen to a guided relaxation way, which is great, but throughout your day. So when you're eating, actually mindful eating is one of the best things we can all be doing for ourselves, because we all tend to, we're overeating and we're not tasting our food, or we're just, it's mechanical. So instead we want, what does it smell like? What is it? Is it warm? Is it spicy? Is it cold? Really with every bite, if you can, learning to sort of tune into it. There's an exercise you can do with, I used to do this with kids I worked with, take a raisin and say, okay, well, what does it feel like? Is it rough? What's the color? And then you bite into, okay, what does it taste like? Is it sweet? Is it salty? Is it sour? Is it chewy? Is it, and then feeling it on your tongue. And so that's mindfulness with something like eating. Even with walking, noticing your surroundings, noticing, the sounds you're hearing, and if you smell anything. When you're sitting, if I'm sitting all day long, I try to wiggle my feet, feel them on the floor. Like I said, feel my bum and my body in my chair, notice my surroundings. It's bringing you into the present moment. And I have driving up there as well, because I think so many of us drive, we go from here to there and we don't even remember driving. It's so automatic now, autopilot. So instead it's really paying attention, and we should all be really doing that, but it's being, having your mindful instead of mindless driving. And you can do it in every way throughout your day. But again, I know it's easier said than done. So this is a practice, okay? So just some other more practical tips. We're at the end here. So, maybe journaling, if that's something that works for you, if writing isn't an issue, or if you can still type and that's something you'd like to do, or if you're a care partner and you're into that kind of thing, journaling thoughts is great. It's another way to learn about our patterns and our thinking process. Learning about our emotions and jotting those down so they're not just stuck within us. And writing out positive affirmations. So that's things like, I am feeling good. I am a good person. It's the positives of certain things. You may even want to set an intention every day. So when you wake up, you take a few breaths and you say, today is going to be a good day. And you sort of, before you set an intention for that day. Practicing deep diaphragmatic breathing. Those are exercises that I didn't go into depth, but that is also one of the easiest ways. That, along with something like a 5 senses exercise, is so helpful. And it's probably the easiest way to calm someone down when they're feeling anxious. And we all should be practicing it, really. So it's, the important thing about this one is that the technique needs to be right. So when people are feeling anxious or activated and someone says, okay, just take a deep breath, that's the right idea, but often they don't have the right technique to actually make it work from a nervous system physiological standpoint. So that's keeping the chest still and really only breathing through the diaphragm. Different way, but it's worth it. And that's something that someone like a counselor can teach you, or there's a lot of videos online. You can look that up. Staying or getting active is another quick tip. We know that's so great for Parkinson's and also for mental health. Limiting news and getting outside more. I think that's so important, especially right now. And then seeking support from professionals and loved ones. These are just some quick last-minute tips. So some key points we covered today are, that remembering that depression and anxiety and apathy, they're real illnesses or real conditions, but they can be treated, okay? Just like symptoms of Parkinson's, they are real symptoms. And apathy may coexist with them. So you may only have apathy or have apathy alongside depression and anxiety. You may only have depression, you may only have anxiety too. I don't know if I made that clear, but they can often go hand in hand. And then acknowledging any mental health challenges is super critical to getting better. So we need to sort of just, again, be self-aware, think about what's happening for us. If anything, just inquiring with our medical professionals, I don't know, is this depression? Well, I don't know, this is how I'm feeling kind of thing. And then listening to our family and or our physician or neurologist's observations about any changes they may notice in our mood. We may sometimes want to get defensive, but I think, having an open mind and just hearing them out would be super important. And then knowing that there are several treatments and therapies, including CBT, cognitive behavior therapy, and mindfulness therapies that we went into in a little bit of depth that you can learn on your own or with a mental health practitioner. And then getting the support you need is, I think, the biggest deal, whether that is through, a support group, through your family, or through counseling, or all of the above. That is fantastic. So just making sure you don't go at this alone, because life's hard enough. We can't go at it alone. So yeah, now we have a little bit of time for questions or comments. I can stick around for maybe like a few more minutes if we have anybody, who has questions. Let me just see here. Don't see any so far. Oh, here we go. Slides are not changing. Yes, there was a bit of a glitch there with some of mine. I'm not sure what happened. Hopefully it improved. I think it improved a little bit after the first few slides. My apologies for that. Okay. John, non-motor symptoms. I've seen in mainly info on there's up to 60. Okay, John had several comments here, not so many questions. He mentions that, yes, there are, several non-motor symptoms. And so he mentioned something about up to 60 non-motor symptoms. Yes, I mean, there isn't a specific number. The interesting thing with Parkinson's, if you aren't aware, is that it is so complex and it is very individual. So I always say, and if when any of you know me, you've probably heard me say this again, but if you walk into a room with 1,000 people with Parkinson's, you may see 1,000 different cases of Parkinson's. So I don't know if there is an exhaustive list of all non-motor symptoms that people may experience, John, but there are numerous, and some people may only, have a couple, and some may have a ton. And likewise with motor symptoms, some may experience several motor symptoms and others may only have tremor. Let's say some people don't have a tremor with Parkinson's disease and only have, let's say, rigidity. So it is, it's pretty complex disease, to say the least. Yeah. Just a few more comments here. He's asking about shame in Parkinson's disease. So shame that's a really tricky one, and it's not studied in particular, you're right, for people with Parkinson's disease. I think that it can be so individual again. And I think it could be referring to so many different things, but a lot of time it's maybe embarrassment about the way they're presenting to, the public or that kind of thing, fear of judgment. But again, for me, and the way I would work was to dig into that and see, well, where does that come from and what is going on that led us to feel this way? Because we often feel a certain way, for example, shame or guilt, based on the way we're thinking in our thinking pattern. So if we can reframe that, we can really help ourselves to feel better. That's just a quick answer. I hope that you got that. Does anybody else have any questions? I don't see any questions up here, just a few comments. That's okay. I think if not, we will just go ahead and wrap up then. Thank you so much, everybody, for sticking around. Hopefully many of you stuck around till the end. And if any questions do come up, please feel free to email either Alana or myself, and we'll get those answered for you.